So, Clive, can you tell us what the Guaranteed Legacy Life Accident and Disability Program is all about?
The Guaranteed Legacy Life Accident Disability Program is affectionately known as the GLAD program, and it is the only house of worship preservation program in the country that was built from the ground up to be able to help houses of worship, their leadership, their spouses, their children, grandchildren, and members, including insulin dependent.
Are there churches or houses of worship right now that are currently benefiting from the GLAD program?
Absolutely. When we launched the GLAD program, we launched it, I think, roughly between November and December of last year. And when we initially launched it, we started with, it was designed so that whether it's a storefront house of worship or a median house of worship or a mega house of worship could participate in the program. And there's several of them right now who are currently benefiting from this type of program.
What makes Guaranteed Legacy different from other programs offered to houses of worship?
Well, first of all, there is no program like the GLAD program at all in the country today. But what sets it apart from other insurance programs that may have been offered into a house of worship is that it protects those house of worship members on three critical fronts. This program protects them with a permanent term life to age 100. That's very unique. And it comes with a quality of life benefit that covers things such as nursing home care, home health care, and long-term care, already built into the program. It also comes with an essential personnel accident program and a congregational accident program for medical. So if one is injured and has to be hospitalized, it will allow them a certain dollar benefit while they're confined in the hospital and trying to recover. And lastly, it comes with an injury disability component built into it. So if a house of worship member is injured and they cannot work on their job, this will allow them to be able to receive up to $500 weekly benefit as an income to protect them while they're recovering.
Clive, can you tell me what was the motivation to create the GLAD program?
It was birthed out of a need within the community. The moral degeneracy of the country is at an all-time high, and we understand that a house of worship happens to be a bedrock in a community. So if the house dies, then the community dies. So we wanted to figure out a way, how do we help a house of worship self-fund? So this was based out of a biblical principle of drinking water from your own cisterns. This way we could teach them how to internalize and to raise funding in-house rather than be dependent on government aid or other outside sources that would impede them being able to do what they really wanted to do for the communities that they were serving. So it was birthed out of that.
Is it right that this program could replace GoFundMe accounts when there are funerals to pay for or medical bills to pay for? Is that correct?
It's funny that you should ask that. That was one of the real reasons why we decided to do something of this nature. You know, houses of worship, when a member passes, they pass a hat, they pass the plate, they have a fish fry when they want to raise money for the building fund, or they have a bake sale. And through the GLAD program, those things can be eliminated completely. GLAD has built into it services that if the house of worship utilizes those services, those programs built into it, they will be able to fund within themselves and not have to have GoFundMe accounts. There'll be money there designed to allow a house of worship to bury their passing members without having to tap into anything, to be able to handle their building funds or their daycare centers, soup kitchens. All that can be utilized through the GLAD program.
Is the GLAD program offered to all religions?
I'm glad you asked that. At GLAD, we believe we're all God's children. Every religion is eligible to benefit from the GLAD program. Whether you're a Christian, whether you're Buddhist, whether you're a Muslim, whether you're a Jew, it doesn't matter. At GLAD, we consider the GLAD program like the gospel of insurance. It really provides benefits for anyone who wants to participate in it if you're a house of worship.
What prevents any group of people from coming together and applying for a program like this?
Unfortunately, the GLAD program is designed specifically for houses of worship. It is not available to the general public. So if you are a house of worship member, yes, you can enter into the GLAD program. If you're not a house of worship member, then we suggest that you find a house of worship that really meets your spiritual needs. And once you've joined that church or that house, then feel free to enter the GLAD program.
Okay. Do you have to be a regular attendee to benefit from this program?
We require at least a 12-month membership at that house before you can enter into the GLAD program. And the reason why we did that is because we wanted to keep the integrity of the program. We didn't want members just joining a house of worship so they can benefit from this unique insurance program and then disappear and not be of any benefit to the house later on. We wanted to create a true partnership between the house, the community, and the insurance company. That is what GLAD is all about.
And who is eligible for the benefits that the GLAD program offers?
All staff, which are paid or voluntary, are eligible to be able to receive a permanent term life to age 100 with quality of life benefits. They can get that. And all non-staff members can also receive a permanent term life from a simplified issue version, meaning they'd have to answer a few health questions where the staff doesn't have to answer any questions at all. And the other thing to remember about that GLAD program, for all staff members, this is not a graded program. Graded meaning if someone passed within 2 years, then the policy would only pay a certain amount. This is what separates GLAD from other insurance products out there. This particular program pays the full death benefit, period, whatever the face amount is. So if a member passes or a staff member passes, it will pay the full face amount at time of death.
That's great. So is the age minimum 18?
If you are a staff member between the ages of 18 and it'll cover from 18 to age 70 actually. So whether you're a staff member or a non-staff member, it'll cover you to age 70, which allows us, we can issue a policy on a 70-year-old, a 30-year policy on a 70-year-old, because it's good to age 100. That separates us from just about any insurance program out there in the country today.
Can children of members or staff also be eligible for the benefits?
Absolutely. A family member can place a policy on a child or a grandchild. There is a certain cap legally on the amount of policy that can be placed on a child or a grandchild. But here's the unique thing with the GLAD program. This is not a rider that's attached to the parent's policy. It's actually a true individual policy for that child or that grandchild. And the beauty of it is that it is what we call a level premium, meaning that whatever the price was when the policy was issued, that price remains the same to age 100.
And what are the coverage amounts for staff and for congregation members?
If you're a staff member in the GLAD program, you're 18 years old to 70 years old as a staff member, you can get up to $75,000 of guaranteed with no questions asked on your permanent term life. If you are a non-staff member, you can receive also $75,000 if you're between the ages of 18 and 50. And if you are between the ages of 51 and 70, you're eligible for $50,000 worth of simplified issue, meaning you'd have to answer a few health questions.
So we know funding can sometimes be an issue for churches. Can you tell us, how does the GLAD program help a house of worship financially?
This is really unique to GLAD. So when a house of worship member applies for a GLAD policy, they get to determine at the point of enrollment how much of a tax-free legacy benefit they want to leave to their house. It can be in the amounts of 2%, 5%, or 11%. But here's what's unique. GLAD and its underwriters now will give a matching 2% in the name of that person as a legacy benefit for the house. So the maximum percentage that can be offered from the GLAD program can be as much as 13% of a death benefit being offered to that house. Another way that the GLAD program benefits a house of worship is that every policy-holding member receives a free legacy travel card program. They're entered into that automatically. And what does this do? It is designed like a Sam's Club or Costco type membership program. And it comes with hotel benefits, resort benefits, vendors that provide dining and electronics. And so just like you would with a Sam's Club or a Costco Club membership, you can utilize that card to be able to purchase that. The card comes automatically with a $500 benefit bank. That's not cash. It is a benefit bank that every time a House of Worship member uses the card online to purchase hotels, they get it at deeply discounted prices. So when that's given to them, every time they use up to $500 on it, it's renewed, but the house receives $50 or 10% that is sent back to the house automatically.
Okay, so they do not have to have a physical building or location for them to qualify for this program?
We just need to know that that gathering of people are actually a worship center, and they're actually serving a community. There are many houses of worship right now who don't have a building at this particular time, and they're renting someplace. They don't own a building, but they want to participate and protect their members because they're serving their community. And as long as they're doing that, and we can verify that, that house of worship is eligible to get into the GLAD program.
What about the enrollment process? Is it lengthy? Is it paperwork? Can it be online? Can you tell us about that?
The enrollment process is all done digitally. So what happens once a House of Worship's staff or the board has agreed to allow the program into the house, and that has been established, they're assigned an advisor. And that advisor will go and then will make a presentation, and then it's digitally enrolled. And once the members are enrolled digitally, whether it's for the life, the accident, and the disability aspect of the program, they are eligible to get 3 free benefits which are offered through the GLAD program. So every member receives it. It's all done digitally. And it can be done in as little as 10 minutes.
How are the benefits paid out?
This is unique to GLAD. If a member passes away, there's usually required a death certificate. With the GLAD program, that death benefit is triggered by a phone call. When a House of Worship member calls to indicate that a member has passed, they're assigned one advisor. That advisor walks them through the whole process, and 15% of the face amount of the policy is issued immediately, because we know that the first 48 hours is very critical. There's pressure on that family to make a decision about a funeral home or what to do next. So we release 15% of the face amount of the policy initially, and that allows them, that money could either be sent directly to the to the funeral home, or it can be sent to the family, so they can be able to determine what they want to do. The other 85%, after GLAD has determined how much legacy benefit that member has left for the house, and that is extracted, or how much quality of life benefit may have been used throughout the lifetime of the policy, then the remaining portion is released. As far as the quality of life benefit goes, all we need is a doctor or some medical personnel to determine that that member has suffered a chronic illness, or they have suffered a cognitive impairment, whether it's Alzheimer's or dementia. And once that has occurred, now within 48 hours, we will release those resources for that member to use for whether it's home health care, nursing home care, or long-term care benefits.
What is the turn time for determining when the larger portion of the benefit is to be paid out after the first 48 hours?
It can take anywhere from 7 business days to 14 business days. It just depends on how long the doctor takes to respond to us, so that we will have bona fide proof that that member has suffered the impairment. So that is really determined by the medical staff. We do our best to try to get that to them as quickly as possible, but we are restricted based on what the medical staff will determine how fast is their turnaround. As far as the death benefit is concerned, once we have determined that there is a death, that gets issued a lot quicker.
Can a member opt out of the benefits?
Yes, they can. They can opt out of any program that they want to. However, why would they want to? Through the GLAD program, they're not only protected, but they're helping their house, who has been serving them over the years. The purpose of the GLAD program is to be able to create an atmosphere where the house can be preserved for the next generation. The GLAD program provides 3 free benefits, just like they provide 3 insurance platforms. They get the life, they get the medical accident, and they get the disability. There are 3 free benefits that comes along with this now, and they are the GLAD membership card, which we did talk about before, but they also get enrolled in our prescription program. Now, this is vital. The cost of prescriptions these days are extremely expensive, and a lot of members cannot afford to have their medications. So once you're a member of the GLAD program and you're a policy-holding legacy member, here's what happens. You get to purchase your medications online at deeply discounted prices. And you have the option of either going to pick them up from the pharmacy, or you can have them valeted to your house. This is a unique benefit that can really help sick and shut-in members, because if you can't get out, how do you get the meds? This will be mailed directly to your home for you. And then the third benefit would be our free Care Angel phone app. This is an artificial intelligence that was designed to specifically help the caregivers. Everybody knows the burden when someone is sick is really on the caregiver. So in the GLAD program, we designed this artificial intelligence that you can program that Care Angel to call your sick and shut-in member 3, 4, 5 times a day to check on them. So while you're at work, Care Angel will call grandma, dad, whomever it may be that's sick at home, and will call them and check on them. Once Care Angel determines that something is wrong, they will alert the care circle, which you'll be a member of, and alert you that something is wrong at home. And now you can be able to tend to that for your sick and shut-in members. This is how you preserve the legacy. And the GLAD program allows each member to benefit from those 3 free benefits. It allows them to also benefit for the insurance side of the programs. So it really is a great program all around. It's a holistic approach to taking care of the legacy of a house.